All right, Dr. Aznavour, we have made another video where you mentioned about implants, and that one of the disadvantages of an implant happens to be that the procedure of doing it from start to finish is a little long, and you might have to do a little bit of a partial in between. Anyway, it takes a while to put the metal rod, the metal stick in it, as I call it, until you finally can put the actual tooth on top. However, there's also, I guess, what they call instant implants. So you literally are done in a day, A to C. Tell us about it. What's the deal?
Well, one of the risks that you're taking when you place an instant implant that they advertise, come in today and you'll leave with teeth, is that you need to have the implant integrate. It's called osseointegration, where the bone heals around the tooth. There's a couple of disadvantages of loading an implant, and that is failure. The reason most of these implants have succeeded with a high success rate is because you let them heal. You let them heal on the upper jaw for about 5 to 6 months, and on the lower jaw about 3 months. The differences between them is that the upper bone is more spongy. It will not heal as fast as the lower bone, where the lower bone is very dense, and that's why you can get a higher success rate. Now with an implant, same-day implants, very risky procedure, because whenever you load an implant, or let's say you put a crown on it and it starts being loaded, because of biting forces, chewing forces, it's not going to let the bone heal properly because the tooth is moving around. The implant, let's say if there's too much force, it will cause the implant to fail. So for example, you place the implant and then you have a bone. So if you leave the implant without anything in there, okay, it's going to let it hold the bone. But if you have something that keeps moving around, you're going to get a gap and it's going to fail. So that's one of the biggest disadvantages of the same-day implant. Get an implant today. Usually I don't recommend it to my patients because of success rates. I want to have happy patients. I don't want to put the implant and have them come back the next day and say, hey, or 6 months or even a year, 5 years, and say, hey, it failed. Of course, there's always failures, but you want to always minimize those failures for the patient. So it sounds great, but it's something that I usually will not recommend to my patients.
Well, all right, that was a very good explanation, and I think in most cases, except if a person has that, like, I need a tooth in today for a wedding, he probably would rather wait. And if he has I need to go to a wedding tonight and I just don't want to have a missing tooth, I'm sure there are some temporary actions which he can take for just that day and look pretty good. Is that right?
That is very correct. We could make either a partial, like a temporary bridge, or a temporary stay plate, which is of course removable, but it'll look just as good, and you're not taking a big risk into failure, which is the biggest issue. Spending all that money and then having it to fail. And once it fails, there's a long recovery time. So you have to recover from the failure, and then you have to try it again. So something that would have taken 4 months to do it properly, or 6 months, now is going to take maybe over a year and a half to do it properly.
With additional cost, I assume.
Additional cost, additional suffering, those are all, like I said, quality of life. You want to improve the quality of your life, but you don't want to, rush it. It's just not worth rushing. Let me put it that way.
And if an implant fails, I assume there's also then, again, an inflammation there, because otherwise it wouldn't fail. Am I right?
Of course, it's the inflammation that causes it to fail. The bone doesn't integrate, you get tissue around it, and that will automatically cause it to fail. The implant becomes loose. So those are all factors, and you have to make sure the inflammation has gone away. You have to make sure additional bone hasn't been lost, because then you're going to need a bone graft. And see, it just adds up. It's not one thing, it's a multiple things that add up, and those are things that you have to watch out for.
Well, it looks to me it's like with everything else, building a house, it doesn't matter what it is you do. a good foundation is a good foundation is a good foundation, and nothing beats that. That's what it looks like what you're saying here.
Yeah, do it right the first time.
Well, all right. Well, thanks, Dr. Aznavour. We'll see you, and I'm sure some of the people listening to this video will come into your practice and see you to get things done first the right way. Bye-bye.
Thank you.